A peak flow meter is a portable handheld device used to measure a breathing maneuver performed by the patient. A peak flow meter measures how quickly air moves out of the lungs when the patient exhales forcefully and is most frequently used by patients with asthma. The medical assistant may be asked to measure the peak flow rate of a patient to determine changes between visits and how well the condition is under control. Sanitize your hands before beginning the procedure. Assemble the equipment. This includes the peak flow meter and a disposable mouthpiece. Prepare the peak flow meter by sliding the indicator on the peak flow meter to the bottom of the numbered scale. Not placing the marker at the bottom of the numbered scale leads to inaccurate test results. Apply a disposable mouthpiece to the mouthpiece holder. The disposable mouthpiece prevents the spread of microorganisms from one patient to another. Greet the patient and introduce yourself. Identify the patient and explain the procedure. Explain to the patient that she will be performing a breathing maneuver several times to see how well her lungs are functioning. Prepare the patient by asking her to remove any heavy or constricting outer clothing, such as a jacket or sweater. Also, ask her to loosen tight clothing, such as a tight collar or anything that may make it difficult for her to perform the breathing maneuvers. If the patient is chewing gum, ask her to discard it in a waste container. Describe and demonstrate the breathing maneuver for the patient. Tell the patient to relax and take the deepest breath possible until her lungs are completely filled with air. Next, tell her to place the mouthpiece in her mouth and seal her lips tightly around it so that all the air leaving the mouth enters the mouthpiece. Then blow out as hard as possible and for as long as possible until her lungs are completely empty. Tell her not to block the opening of the mouthpiece with her tongue. Tell the patient you will repeat the instructions during the test. Encourage her to remain calm. Fear and anxiety can lead to unreliable results. Place a new disposable mouthpiece on the peak flow meter. Slide the marker to the bottom of the numbered scale. Hand the peak flow meter to the patient. Instruct the patient to stand up straight and look straight ahead. Begin the test. Actively coach the patient. Note the number where the indicator stopped on the scale of the peak flow meter. Jot down the number on a piece of paper. If the patient coughs or does not perform the breathing maneuver correctly, do not write down the number. Inform the patient of what modifications are needed for the next effort. Continue until 3 acceptable efforts have been obtained. Make sure to slide the marker to the bottom of the scale before each measurement. 3 acceptable efforts must be obtained to ensure that the test results are valid. If the patient performs the breathing maneuver correctly, the numbers from the 3 tests should be about the same. Take the peak flow meter from the patient and remove the mouthpiece from the mouthpiece holder. Dispose of the mouthpiece in a regular waste container. Sanitize your hands. Note the highest of the 3 peak flow measurements. Do not calculate an average. Chart the procedure. Include the date, the time, the name of the procedure, and the highest peak flow expiratory reading. Clean the peak flow meter by washing it in warm soapy water, rinsing it thoroughly, and allowing it to dry completely.